Hi, this is Inga Hansen with MedEsthetics magazine, and I'm here with Dr. Ronald Moy at his new practice in Beverly Hills, California. And wanted to talk with you a little bit because you're beginning just now your tenure as the president of the American Academy of Dermatology about what you feel some of the big challenges are that are facing dermatologists today.
I think dermatologists are facing a lot of the issues that all physicians are facing, such as, a presumed possible 30% cut in Medicare. That was very scary. And of course, Congress stalled that for 1 year. But what happens in 1 year? So that's one of our top priorities. But we have other issues. There's a lot of changes going on. There's more government intervention in our practices. There's a lot of changes in the demographics of this country, a lot more older people, so there's a lot more treatment of skin diseases in the future, and we don't really have a big expanding workforce. There's not a greater number of dermatologists. So we have a lot of those issues before us. And then there's the same type of just practice issues that we all have as physicians. It's sort of a hard day when we're seeing patients from the beginning of the day to the end of the day. We have patient phone calls to return. We have electronic medical records that the government's going to require. So among all those things, it's even hard to prioritize which of those changes are most important. But I think that those are some of the important issues.
Okay. Now, how do you feel that this new sort of field of non-invasive cosmetic treatments have become such a big part of dermatology? How do you feel that that's affected the specialty?
Well, one of the reasons it's been started among dermatologists is that dermatologists were innovators in that field of non-invasive technology. So a lot of it's new technology, and new technology, of course, is driving medicine. I think it's changed dermatology and it's made it more cosmetic. I mean, most dermatologists don't practice totally cosmetic dermatology, but many of us practice, a portion of our practice time is with these type of non-invasive cosmetic procedures, along with fillers and Botox or Dysport, and then these non-invasive lasers and other types of new technologies. So it may change it. I think new technology is making medicine change. I think there'll be more of those type of devices and technologies in the future, and there's more baby boomers who are asking for these treatments. But we still have a lot of medical dermatology, a lot of skin cancers we're treating, a lot of skin, hair, and nails that we're treating. So sometimes people get the wrong picture. It's not just cosmetic dermatology.
Now, do you find that these two patient groups are distinct patient groups, or more of the medical dermatology and cosmetic, or is there a crossover that you've seen in your practices?
That's a good question, whether the patients are the same, the medical dermatology patients and the cosmetic dermatology patients. Well, they're often the same. They're often people who come in and didn't realize that you can erase a wrinkle or make a wrinkle go away. Sometimes cosmetic dermatology people seek us out, people who look and say who has the latest technology. And especially since we moved our office, for 22 years we were at UCLA, and so we were a very academic practice. We did some cosmetic dermatology, but we did a lot of skin cancer. Now that we moved to Rodeo Drive and Beverly Hills, the perception is that we're a little bit more cosmetic. And I think that some patients certainly are just cosmetic patients, but majority of people are sort of do both. They come in and ask us for issues, whether it's medical dermatology or surgical dermatology or cosmetic dermatology.
Now, what advice would you offer to new physicians coming into the field, and specifically new dermatologists coming into practice?
For new dermatologists, it's probably more difficult. Maybe it's the same. I think that it's always hard because there's more to learn. So training is number one, to get the good training in all these new technologies, to get surgical training, a good residency. Then the competition. There's more competition, not just among dermatologists. There's people who are acting as dermatologists sometimes and practice in that field. And so a lot of these areas, there's more competition. And Rex Amonet, who's a mentor of mine, said, the best thing you could do is try to be nice to every single patient. Do something special for every single patient. And that's probably the biggest practice builder that I know of.
Great. Well, thank you very much for speaking with us, and good luck with your year with the AAD.
Thank you very much.